Prostate enlargement is a very common condition among men. It's often underdiagnosed, but the incidence of prostate enlargement in men is about 50% at age of 50. This goes up to about 60% of men at 60, and up to about 80% of men at age of 80 have this prostate enlargement. The presenting symptom is urinary problems. So you feel like going to pee very often. You wake up in the middle of the night twice, 5 times, 7 times. This disrupts your quality of life. You need to go to pass urine, and then when you go to pass urine, you pass a little and you cannot pass anymore. So you come back to sleep and then you go back again. Imagine this happening 7 times a night. The first treatment option that everyone should try is first medical therapy. So you have drugs that are meant to improve the blood flow. But often these drugs are effective, but they're associated with side effects. And a lot of side effects are related to sexual dysfunction. The other is surgical options. Surgical options may be associated with bleeding and other complications. We are nestled between the two. We have a new treatment option, and this is very novel. It's called prostate artery embolization. It's basically a procedure where you block the blood flow to the prostate, and thus the prostate shrinks because of lack of blood flow.
Prostate artery embolization involves access of the artery from your wrist and actually passing a tube right up to the artery reaching up to the prostate. What we do is we inject the contrast, identify the arteries going into the prostate, and put some particles. These particles block the blood supply to the prostate, and eventually over the period of time, the prostate decreases in size and actually markedly decreases the symptoms.
The success rate of prostate artery embolization so far has been very similar to surgical therapies. Most patients report a success rate of between 80 to 92%. That's how the success rates are. First of all, you preserve your prostate, and second, you do not have the side effects of surgery. You do not have bleeding because you cut off the blood supply to the prostate. You maintain your sexual function. Besides that, the quality of life becomes dramatically improved. Patients who have urinary obstruction and need catheters to be placed just to pass urine have reported outcomes. In 7 days after the procedure, they are catheter-free. They don't require any catheter to pass urine.